Good morning, everyone. Welcome to our COVID-19 meeting. Today is Friday, the 27th of March. We are in day 10 of our self-imposed quarantine that is going to run through at least the end of this month. And as we talked about previously, the president and our national task force is looking at extending this. The president is saying at least through April 12th, which is Easter Sunday. Some of his medical experts are suggesting that this could go on for a longer period. Let's take a look at where we are over the last two. Okay, let's go to our tracking map over here. This is the update from yesterday. Again, we look at this on an every 2-day basis. You can see up here in New York City, that's the largest concentration of the outbreak in the United States. They estimate that nearly 60% of the new cases have come from that eastern seaboard, particularly New Rochelle, New York City, and we continue to watch that. We have seen several other epicenters beginning to develop. We have one up here in Detroit, Michigan. We have another one up in Nashville, and one that has really exploded over the last 2 days down in New Orleans. One other thing that we talked about on Wednesday is how the middle of the country is beginning to populate. We had already seen that everything to the east of the Mississippi River was pretty much covered, and sure enough, you can now see the band across the western states that are beginning to show signs of the virus. All right, we're going to continue by looking at the local numbers and sort of seeing where we stand. And there's some good news. We're going to start with maybe something that is not quite as encouraging, and that's the fact that the United States now has the dubious distinction of being the country on the planet Earth with the highest number of COVID cases. We have moved ahead of both Italy and China. There are 86,000 cases in the United States, and there have been about 1,300 fatalities. Looking locally, it gets a little better. The state of Florida has had 2,084 cases, and to date, only 29 deaths. And when we look at Pinellas County, things are even better. We have had 64 cases and still only 1 death. And so Pinellas County was very quick to react. They imposed the social distancing and the lockdown for nursing homes, healthcare communities. They shut down non-essential travel and businesses, and it really is paying off those early decisive decisions made by local authorities. In Pasco County, the numbers are even better. We track Pasco County because it's our truly only adjoining county, and their numbers are 19 cases and 1 death. Hillsborough County continues to be problematic, and there is the potential for that becoming an epicenter for the spread of the virus. We're very fortunate because there is a body of water that protects this lower end of the peninsula, and so that seems to have had an effect in helping reduce the number or the spread here in Pinellas County. In terms of our quarantine, we still have the 9 residents who went on the cruise. All of them are doing very, very well. They will be coming off quarantine on Sunday, and we're confident that we'll be able to welcome them back into community life. We do have 1 new resident that is showing symptoms, and they are on isolation in the community. They've been tested, and we are awaiting results. In terms of our staff, we're down to 1 person who is currently being tested, awaiting results. All other staff members have been cleared and deemed safe to return to the community because we identified them as flu symptoms as opposed to COVID. We still have no confirmed cases of COVID-19 amongst our staff or our residents. And so all this hard work and the effort you put into social distancing and isolating, staying at home, really is making a difference and helping keep all of us safe. We're going to start now. I'm going to turn to Leslie and ask her to give us an update.
So today on Fox 13 on Good Day Tampa Bay with Charlie's World, we were featured, Regency Oaks, with the help of the Belchers. We were able to show everyone all the prep that we are doing here at Regency Oaks with our dining team, housekeeping, maintenance, and keeping everything normal, to show that our hardworking team is doing a great job so that we are safe here at Regency Oaks. And we're going to do our best to see if we can get that put on with this so that everyone has a chance to see it. We will try our best. Now, in regards to toilet paper, we are selling it for $3 a roll, one toilet paper roll a week, and so far we have 11 requests, so that's good. And I just want to give a shout out to all of our hard-working staff members that are going through a change of job roles, from our transportation to helping out the front desk, as well as our housekeeping, keeping everything clean, and our maintenance, just keeping everything up to date. So thank you so much for your hard work, everyone.
And Phil is with us this morning from our dining team. What do you have to share, Phil?
Hello. I just wanted to share that everything is going so well in the dining team as far as delivery and meal service that we have decided to streamline it just a little bit more. On Sunday, we will be going to a 1 meal a day or 1 delivery a day plan. This will help with social distancing so that we're not bringing people to your door twice a day. Rather, now they'll only be there once a day. We'll be there between noon and 3 o'clock every day with a fresh meal, breakfast, lunch, and dinner for you to eat at your whim. We appreciate your understanding with this. The menus have gone out. Please fill them out and return them to us, again, at your convenience, so that we can get you the food that you so desperately want. As far as social distancing goes, we've asked our vendors, where applicable, to drop their services at the door. So our linen company, our knife company, our bread distributor, and our liquor distributor are dropping their food at the door, and we're then in turn transporting it to the kitchens where they're needed. The 2 companies that we're allowing in are with perishable goods, Cisco and Produce. Those they bring right in, drop them right off at the kitchen, and then leave. And that just allows for a fresher quality for you when you receive it.
All right. Thank you very much, Phil. The next thing I'd like to do is spend the balance of our time going out into the community and showing you some best practices. We've gotten some feedback that you enjoyed seeing some of the behind-the-scenes operations, so we're going to do that now. Okay, this is over here at the north front desk at the check-in station. Tuck is manning the station here this morning, and I'm going to demonstrate the procedure we've set up for our associates and anyone else to actually get into the community. And this screening process is pretty involved. I'm going to talk a little bit as we go through. The first thing I have to do is fill out a form. And on this form, I'm going to provide my name, my associate number, my department. Okay, so I have signed in, and I'm going to submit to a temperature screen. Tuck's going to take my temperature.
Yes, sir. All right, here we go. 97.2.
97.2, I'm normal. Now, Tuck is also going to ask me a series of yes or no questions that are provided here.
Have you or someone been, excuse me, have close contact travel internationally?
All right, here is the list of the questions that Tuck is going to be asking me.
Have you or someone in whom you've had close contact traveled internationally or within the last 14 days?
They have not.
have you or someone you have close contact with who have positive for COVID-19 or being investigated for COVID-19?
They have not.
And number 3, have you or someone you have close contact with worked or visited another health care facility, senior living community, where there has been any confirmed cases of COVID-19?
I have not.
All right, sir. Thank you.
All right.
And I'll get you to sign. Just here to take your temperature, which we have already done.
All right, Tuck, I appreciate it, and
Anytime, sir.
get out of the way and let our next person up. Many of the residents have asked me, you know, you're not allowing our family, our friends, visitors to come into the community, and what's the point of that? And here's sort of how that works. You're coming into Regency Oaks and you're a first-time visitor, or we're tracking you for the first time. We'll take your temperature, but we have no way of knowing whether that temperature has gone up or down because we don't have a tracking history. We do the tracking history that you just saw with every single associate that comes into the building, so that we have information on a daily basis. What it allows us to do is identify that early trend. We've created a spreadsheet that provides tracking information, and if we see a spike over a 36-hour, 48-hour period, then we know that there is an issue that we can address by self-isolating and removing that associate until either we get a COVID test or a flu diagnosis. It's that consistency of testing day in and day out and creating a history that allows us to know that our associates are safe to be amongst the residents, as opposed to a family member who's out and about in the community but coming into the community without any kind of tracking history. And that's how that is successful. Go and have a great weekend. Be safe. There's not a lot of sports to watch on TV, but we have a couple of great movies lined up. And look for ways to video chat with the kids, enjoy each other's company, gather in small groups, get outdoors, and have a great weekend. We'll see you back here Monday.